There being 92 ayes and 52 nays, the amendment to the amendment is adopted. The chair recognizes Dr. Oliverson to speak on the amendment as amended.
Thank you, Mr. Speaker, members. So again, the amendment as amended increases funding for Thriving Texas Families. This is a great program, members. We used to call it Alternatives to Abortion.
Ms. Howard, for what purpose?
But
Yes, would the gentleman yield for some
if I
questions?
could
the
just
gentleman yield?
read a little bit, I'd be happy
Of course.
to. Yes,
Thank
ma'am. So this program promotes healthy pregnancy and childbirth. It supports moms who choose to have their baby. It increases access to resources that promote family and child development. It encourages families to stay together and support each other. It teaches parents to implement successful parenting techniques. It helps families learn to take care of themselves financially. And it provides personalized support to pregnant women to make sure that mom feels ready to have her baby. And the additional dollars that we're appropriating today will help further the mission of this very successful program, providing pregnant women with the support that they need to have a healthy pregnancy and a healthy baby. And I'm happy to yield for questions.
The gentleman yields for questions.
Thank you, Mr. Speaker. Thank you, Representative Oliverson. I don't have the report in front of me, but I assume that you have looked at the report, the last report submitted by this program as to what their outcomes are, have you not?
I don't have it in front of me either, Representative. I apologize.
But I mean, you just laid out all the things that you thought it had done.
Yes.
I appreciate the efforts to do anything to help moms and babies and families, absolutely. And I think there's a variety of ways that we could support that in our budget. The concern I have about this is that we haven't, I think, done enough to provide the actual programs that are delivering the kind of services that could really do a lot more to help our families be successful. Many of the outcomes are based on handing out pamphlets. They're not getting the referrals made to the appropriate support services because, as you know, Thriving Texas Families does not provide health care. They only do the other support kind of services. And so we've talked about including other specific things, other specific programs in this strategy so that we could actually beef up some of those other programs that are really delivering a more robust services, such as the Nurse Family Partnership, and also had some information we considered in appropriations in our subcommittee on creating a program for parents in recovery so that we could keep moms and babies together. The mom can actually recover, because as you also probably know, do you not, that one of the leading causes of death of moms here in Texas is substance abuse?
I am aware that substance abuse contributes to maternal morbidity and mortality.
So what I would ask you is, when you're looking at putting more money into this, can we look at actually what programs might actually be delivered that have real outcomes that are going to help Texas families, as opposed to, you know, listing a bunch of pamphlets that have been given out and maybe a class that's been given? Can we look at expanding this so that we actually know that we're giving this money to programs that are really delivering services that are going to help Texas families thrive? Can we talk some more about that?
So, Representative, I'm always willing to visit about, and obviously I like to have more services rather than less. What I know about this program is that there's been 2.8 million clients served, over 150,000 patients. It is highly successful. One of the reasons we're increasing funding to this program is because essentially it keeps using all the resources we appropriate because of the great need. And so while I agree with you in the standpoint of I do think that maternal mortality and morbidity is something that we should be focused on, and I have in the past and will continue to work with you on a variety of fronts to try to address that. The purpose of this amendment here is to increase funding specifically for a program that's been proven to be highly successful and provides, to my understanding, a wide variety of services to support pregnant women and their families.
And again, I know you told me you don't have the report in front of you, but did you not just read me some statistics about some of the numbers that have been served?
Some, yes.
Yeah, and do you have information about what those services are that were provided in that?
Well, I
total?
read you a list of the services that I'm aware of that Thriving Texas Families provides.
Okay. I really want to work with you on this. I think that there are many things that we could do to help families and parents and their babies and their children. I want to make sure it's real services. And unfortunately, the report that I've read doesn't show that that's actually the case. So I would hope that we could expand this. If you're going to put more money in it, I hope you will consider making sure that that money is spent on programs that are actually going to be delivering services that will support these families. So thank you.
Thank you, Representative.
Mr. Speaker,
Ms. Gervin Hawkins, for what purpose?
would the gentleman yield for a couple questions?
Does the gentleman yield?
Yes, I yield for questions.
So I want to be clear on your amendment. So you're taking $20 million from the Medicaid program?
So we're actually taking a total of $70 million over the next biennium.
$70 million over the next biennium to create a new program?
No, to increase funding to an existing program, which has proven highly successful.
But you don't have the statistics?
I have read you what I have in front of me, Representative.
And so talk to us a little bit about where the advantages to that program, what has it netted in terms of results, in terms of direct individual results?
I'm sorry, I don't understand your question. I apologize.
So in terms of the benefits to an individual, could you help us understand, are those benefits for actual services? Are those benefits for education? Is those benefits for care? What is the benefits?
Yes, Representative, as I said earlier, there are a variety of benefits and services that are provided through this program. It's not just about it's not just about a moment in time. It's actually about helping to provide services so that there's a healthy environment for that mom, a supportive environment, so that as she chooses to have the baby, to choose life, that she has access to resources that are needed.
Dr. Alverson, with all due respect, could you be more specific? You're saying services.
Yes.
You have to be knowledgeable. If you're expecting us to put $70 million in a program, is that residential care? Is that medical care? What is it specifically that the program is doing?
So again, Representative, the program provides support in a variety of ways to families, to the mom, it provides a personalized support program throughout the course of pregnancy so that she actually has the resources that she needs to be supported. It helps families to understand the financial burdens that they may face raising a child. It's kind of a wraparound program, and it's not a new program. This program's been around for longer than I've been here in the House.
And who are the
providers? And it's been highly successful.
Who are the providers of these programs?
There are a variety of providers to this program.
Could you
in
name
fact,
one or two?
I can't. I'm sorry.
You can't name one or two?
I know there's quite a few.
You can't name one or two providers?
There are several crisis pregnancy centers, literally pregnancy assistance centers throughout our state in various locations.
So no specific services you can
200 physical
name,
locations.
no providers you can name, but you want to put $70 million and you want us to vote on that.
I do, yeah.
So members, I think that when we talk about spending $70 million on something, we've got to be more specific and not general. I think that's a major investment, and I too agree that we want to be able to support mothers and babies and things like that. But to do it without knowing any specifics is quite concerning that we would vote on something like that without having any specific level of services and or outcomes and or providers. Is this a vendor bill?
It is not.
Is it but you don't know any of the entities who's getting these resources?
Representative, again, this is not a new program. This is not a bill. We're seeking to increase funding to an existing program that has been in our budget for a very, very long time.
But if it's existing, but you can't name a service, you can't name a provider, but it's been existing?
I can read to you from the code, from the statute, the services that are provided through the program, if that would be helpful.
No, all I would just say is, members, I'm concerned when
mean,
we
I-
can't be specific.
Yeah, I mean, it says, here is what is provided: counseling and mentoring on pregnancy, education, parenting skills, adoption services, life skills.
The gentleman's time has expired.
Move adoption.
Mr. Speaker, I move for a short extension of time, please.
Members, is there objection to an extension of time?
Oh, come on.
That's all right.
There-
It's okay.
Members, there is an objection to the extension of time.
Mr. Speaker, parliamentary inquiry.
Members, a record vote has been requested on the extension of time. All those in favor, please vote aye. All those opposed, vote nay. The clerk will ring the bell. Show Dr. Oliverson voting aye. Show Mr. Lauterbach voting aye. Show Mr. Vasut voting aye. Show Mr. Leach voting aye. Show Mr. Bonin voting aye. Show Mr. Morgan voting aye. Show Mr. Alders voting aye. Show Ms. Isaac voting aye. Show Ms. Troxclair voting aye. Show Ms. Luther voting aye. Show Ms. Garza of Bear voting aye. Show Mr. Jones of Dallas voting aye. Have all members registered?
These are the names of the 4 contracted service
There being
providers.
135 ayes and 10 nays,
Great.
Contracted service provider.
the gentleman's time has expired. Excuse me,
Oh, yeah,
the gentleman's time is extended.
Thank you, Dr. Oliverson, for your statesman-like vote. I appreciate that. My question is a genuine question. It's not to belabor the point. The manner in which we conduct the
Mr. Canales, for what purpose?
Mr. Speaker, if the gentleman would yield for some questions.
Gentleman yield for questions.
I yield for questions.
Gentleman yields.
Thank you, Dr. Oliverson, again for your statesman-like vote there. I do not wish to belabor the point or drag this out any longer. The way we conduct the budget is we take and we put. And so here we're taking and we're putting. And so we're taking $70 million from Medicaid. Is that correct?
That is correct.
And all my question is what programs suffer under that point? Because we're taking money, can you identify and explain to the body where you're taking the $70 million from Medicaid, and we know where you're putting it, but what is it doing to the Medicaid and what programs?
It doesn't affect the Medicaid program at all. This Medicaid is an entitlement program, so the people who are eligible for services under our Medicaid program will continue to receive those services.
So
So
there's-
we're not shortchanging anybody,
So
Representative.
there's no difference in the funding if you're taking $70 million, there's no effect to Medicaid?
That's correct.
I don't know how that's possible, but I appreciate your response.
My pleasure, sir.
Mr. Speaker, will the gentleman yield?
Does the gentleman yield?
I yield for questions.
Gentleman
So-
yields.
So just to follow up, you're sure that none of this money is going to affect children that are receiving medical services from Medicaid, such as CHIP, or any other programs? Can you identify those programs that you are taking money from?
We're taking the money from the Medicaid program.
Well, name the programs that you are going to shortchange by taking $70 million away from Medicaid.
So again,
Isn't that for indigent Texans?
Respectfully, Representative, the Medicaid program is an entitlement program, and so one of the things that we will do this evening is passing a supplemental appropriations bill that will provide a true-up for services that are covered under the Medicaid program that have been provided.
Well, why
and
don't
in
you-
2 years, we'll do that again.
Why don't you wait for the supplemental to get this $70 million and leave Medicaid alone?
So I would prefer to do it now.
Why? Because you probably think the other isn't going to pass. Is that correct?
No, this is the mechanism that we've chosen. It's a legitimate, viable mechanism, and it's not going to take programs away from people on the Medicaid program, and so this is a great source for this.
And yet you're not willing to name one service or one program that is funded by the money that you're taking, $70 million. You can't name providers, you can't name programs, you can't name services. Are these people just providing flyers and
respectfully, Representative, the Medicaid program doesn't work like that. So we're
I'm not talking about Medicaid. I'm talking about your Thriving Families program. You are not able to name one service that is provided or any providers
So-
or any of
so
the
I've-
quote-unquote clinics. You have not
Yeah.
named any of those.
I've read the list to you or to the body a couple of times of
When?
services that are provided, Representative. I can say I do have a list in front of me of some of the top providers in our state, the Texas Crisis Pregnancy.
I have not heard anything being read.
Sorry,
Can
Texas
you read those
Pregnancy
to us?
Care Network, Source for Women, Pregnancy Center of the Coastal Bend, and Carolyn House are the top 4 providers in our state.
How much do they get each?
I don't have that information in front
Well,
of me,
you must know
Representative.
they're the top ones.
It's fee-for-service reimbursement.
So it's typically fee-for-service reimbursement, so similar to the Medicaid program.
Well, surely somebody has a ledger and tallies up how many providers are providing X number of services for X number of dollars. Isn't that what responsible fiscal practices are? Shouldn't we know? Shouldn't the state know exactly how much is being funded for which services? Because that's fiscally responsible. Why are you allowing these providers to skate with such vague information when you're giving them so much money and you're saying that it's so much better? You have to have some metrics that show what you're alleging.
There are. I just don't have them in front of me.
Well, that's pretty shameful, I believe.
Well, I'm sorry that you're disappointed.
Well, I am. And I'm
Okay.
disappointed that you're taking money from indigent Texans to fund something that is smoke and mirrors, and it's really offensive.
I'm sorry you feel that way.
Mr. Turner, for what purpose?
Mr. Speaker, with the gentleman yield for some
Does
questions.
the gentleman yield for questions?
I yield for questions.
Gentleman yields.
Thank you, Dr. Alverson. So I want to follow up on the dialogue you just had with our colleagues. With respect to the $70 million that you're moving out of the Medicaid program, you said it's not going to affect services for children, if I heard you correctly. Is that right?
For Medicaid beneficiaries,
For Medicaid beneficiaries, so children and adults.
for those that are currently on the Medicaid
Okay,
program.
so the Medicaid program in the state, correct me if I'm wrong, but the Medicaid program in the state of Texas provides healthcare services to children. In fact, 3 out of 8 children in Texas receive Medicaid, and 1 out of 12 Texas adults receive Medicaid. That's essentially what Medicaid does in the state of Texas. Is that fair to say?
I will accept those numbers, sure.
Okay, so if we take $70 million from a program that does 2 things, serves 1 out of 12 Texas adults and 3 out of 8 Texas children, how are we not reducing services if we're cutting $70 million from those 2 services?
Well, respectfully, Representative, because of the mechanism that we use to pay for Medicaid, those services that are covered will pay those services. And as you know, this is part of our appropriations process, is that the Medicaid program is trued up at the end of every biennium. And so that's the mechanism by which we keep our promises.
So you mentioned the true up, and you alluded to the supplemental appropriations bill we're going to hear later tonight. So the supplemental appropriations bill always, since I've been here anyway, always covers a Medicaid shortfall, correct?
I apologize. I couldn't hear the last part of your question.
The supplemental appropriations bill, most times we take it up, usually covers a Medicaid shortfall for the current biennium. Is that true?
That is not uncommon.
Right. Okay.
I don't-
So,
yeah.
so when you suggest that this is going to be resolved through the normal appropriations process, I think what you're really saying is that you are going to cause a $70 million shortfall for the next biennium, and the legislature is going to have to come back in 2 years and pass a supplemental appropriations bill to cover a deficit in Medicaid that is going to be caused by this amendment. Is that right?
I don't think you can predict that in the future, which is
Well,
why we,
okay.
right?
But Dr. Robertson, you just said you're taking $70 million from Medicaid. We've established
Yeah.
Medicaid does 2 things. It provides health care for a lot of kids and
Sure.
some adults. So we're taking $70 million from those services. You said we're not going to cut any services, and it's going to be resolved through the normal appropriations process, which you then alluded to the true-up, which is the supplemental appropriations bill. So my question is essentially what you're doing causing a $70 million deficit in the Medicaid program in the next biennium that the next legislature will have to come back and fix through through a supplemental appropriations bill when we have no idea what the revenue estimate's going to be 2 years from now. We don't know if we're going to be in a recession. We don't know if we're going to have a budget shortfall. And we're creating a $70 million hole 2 years in advance. That's what we're doing with this amendment, is it not?
That's not my understanding, no.
Well, I think, respectfully, Dr. Alvison, I think in so many words, you said that's essentially what we're going to do. We're going to fix the $70 million shortfall through the normal appropriations process, and you talked about the true-up, which is a supplemental appropriations bill. The only way to do that, to my knowledge, is to do it through a supplemental appropriations bill in 2027, and I don't think we ought to obligate the future legislature on purpose to having to cover a $70 million deficit in Medicaid, because these are services that provide health care, as I said, to 3 out of 8 Texas children, 1 out of 12 Texas adults, and we need to honor our commitment there. But let me ask you one other thing. Are you aware that Texas, in the post-pandemic era, was the most aggressive state in the country in terms of the Medicaid unwinding, that millions of people lost their Medicaid coverage in very short order, and we have found in that time period that a lot of people who are qualified for Medicaid were actually cut from the program, though they should not have been. Are you aware of that?
I am not aware of that.
You're not aware of that?
No.
You're not aware of are you aware of the Medicaid unwinding process?
I am aware of that process.
Okay.
I am
Are
not
you aware that?
I'm not aware that that process has proceeded in a way that is. Sorry.
The gentleman's time
Move
has
adoption.
expired.
Move adoption.
The question is on the amendment as amended. This is a record vote. The clerk will ring the bell. Service Alderson voting aye. Harris Davila voting aye. Troxler voting aye. Cody Harris voting aye. Have all members voted? Have all members voted? There being 90 ayes and 56 nays, the amendment is adopted.